At any rate, let me go ahead and introduce everybody here. My name is Dr. Mark Ettensohn. I'm a clinical psychologist and specialist in the treatment and assessment of pathological narcissism and NPD. And I'm joined by my two associates here, Dr. Deanna Young and Danté Spencer. Let's go ahead and give you guys a chance to introduce yourselves. We'll start with you, Deanna.
Hey everybody, very excited to be here. My name is Dr. Deanna Young. I recently received my doctorate from Alliant International University, and I just finished my internship at the Renfrew Center for Eating Disorders in Florida. I'm really interested in working with Dr. Ettensohn because I'm really interested in interpersonal trauma and how individuals developed through their childhood and the ways that they've lived this complex life. Happy to be here.
All right. Thanks so much, and congratulations on the doctorate. That's fantastic. Big accomplishment.
Thank you.
Dante.
Yes, hi. So I'm Danté Spencer, and I am completing my dissertation. So I'm in the dissertation phase. I have about a month to go before my doctorate. I completed my internship at the counseling center at Pepperdine Counseling Center, and I've recently gotten interested and I'm actually graduating from Pacifica Graduate Institute. It's a depth psychology, it's clinical psychology, but we emphasize depth psychology. And I really got interested in, I guess you could say, um, narcissistic personality disorder, um, because of the way that I feel society has negatively viewed narcissism. And I like the way that Dr. Eatonson really unpacks narcissism as a disorder that can be healed and helped versus just demonized. So I was really attracted to really trying to get into the bottom, see how narcissism is organized within the individual and how it can be how it could be healed.
Right on. Well, thanks so much for being here, guys. And just a bit of a disclaimer to everybody watching, where this is the first time we're doing this. This is uncharted territory for us. So we're going to try out a format. We'll see if it works, and we might make some adjustments moving forward. But the idea here is really to try to give folks a glimpse into how clinicians who work with these issues think about them and conceptualize. As well as to try to do a bit of a public service here in terms of increasing the depth and the complexity of the discourse around some of these issues. And we're hoping to do that through the use of some of the articles that we discuss. So today, I picked an article that was very influential to me when I read it. This is a literature review conducted in 2010 in preparation for the publication of the DSM-5, which came out in 2013. So for a while there, the diagnosis of NPD, narcissistic personality disorder, was kind of on the chopping block because there has been increasing criticism of its validity as a construct. And what that means is that, a psychological construct, right? Any construct, major depressive disorder, narcissistic personality disorder, it needs to have a certain level of fidelity in terms of how it describes the population in the real world, right? And if it doesn't do that, if it falls short or if it doesn't quite get it right, then we say that that construct is invalid. And there has been increasing, concern that the DSM's construct of NPD is not valid. It doesn't accurately describe the clinical population of folks who are dealing with these issues. So this article was the first to my knowledge, to really kind of distill the kind of Tower of Babel, so to speak, that has been the research literature on pathological narcissism for the last 40 years, and really kind of point out, hey, look, we've got a problem here. So it's called Pathological Narcissism and Narcissistic Personality Disorder. It's by Aaron Pincus and Mark Lukowitsky. This is a peer-reviewed journal article. It appeared in the annual review of clinical psychology in 2010. I'm going to go ahead and read a little synopsis here to get us started. So, Aaron Pincus and Mark Lukowitsky's 2010 review, Pathological Narcissism and Narcissistic Personality Disorder, I can say that word, examines the long-standing confusion surrounding how narcissism is defined, measured, and classified. They identify a criterion problem, that is an inconsistent construct definition that has led to disparate assessment tools and fragmented research across clinical, psychiatric, and social personality psychology. The article distinguishes between normal and pathological narcissism, emphasizing that most research uses non-clinical samples and that widely used measures like the NPI, that's the Narcissistic Personality Inventory, largely capture what could be considered adaptive or normal narcissism rather than its pathological form. Pincus and Lukowitsky highlight two core phenotypic dimensions of pathological narcissism. Phenotype is sort of the form that an illness or disorder or variation shows up in. The first is grandiosity, and then there's also vulnerability. And these often oscillate within the same individual. They argue that the DSM's exclusive focus on grandiosity has led to diagnostic blind spots and under-recognition of narcissistic suffering in clinical settings. The authors also critique the overt versus covert distinction, suggesting it reflects differences in expression rather than separate narcissistic types. Finally, they discuss taxonomic approaches, that is, approaches to sort of categorizing narcissistic pathology. And they list three: categorical, prototypic, and dimensional models. Categorical would be like the DSM uses, right? So you have its NPD or its BPD or its histrionic or its, right? Prototypic would be comparing sort of a real world phenomenon to a kind of idealized prototype. So the idea is, well, this is what NPD, what pure NPD would look like, right? And then we sort of measure a person's narcissism compared to that. And dimensional would be thinking of things as like a spectrum, right? So this is more like the ICD model now for personality pathology, that there's a spectrum of personality health and the person falls somewhere along that spectrum. And the authors end up supporting dimensional models that capture the full spectrum from health to pathological narcissism. They note that this debate parallels issues in distinguishing other psychological phenomena, for instance, psychopathy versus antisocial personality disorder. So, antisocial personality disorder involves psychopathy, but they're not the same thing, right? Same thing with NPD versus pathological narcissism. NPD involves pathological narcissism, but are they the same thing? The authors conclude that integrating grandiosity and vulnerability into revised diagnostic and assessment models is essential for coherent theory, accurate diagnosis, and effective treatment. Everybody get all that? Probably not. I'm not sure that I got it all, but we'll see. We'll just start talking about it and we'll see where we end up. So I just kind of want to open up the floor here and ask you guys, what's your takeaway? Like, what did you think of this article? What stood out to you, if anything?
Yeah. Yeah, this is really good. I think it's important to really look back in the beginnings, like with narcissism, how it was described, like Freud, right? It's from the mythology narcissist, where he looks into the lake and sees his reflection. He gets self-absorbed with that, and eventually that's his downfall, right? Thinking so highly of himself. And so I think like with this article, I know it was like 15 years ago, but I take it as probably one of the first peer review that really started to talk about the vulnerable type of narcissist, which is like not included in the DSM. So I guess my first question is, where did that first come online, that other type? Because we all know the grandiose, that's what people think of when they think of a person who's narcissist or as NPD. But now we know that a person can show up vulnerable with a lot of shame, and it it be showcased very differently than your typical grandiose. So like, where did this first come online as like this is part of the same pathology? the vulnerable type.
Yeah, that's a great question, and one that the article involves, and we'll maybe this is something we can talk about as well. A 40-year lit review going all the way back to 1971, I believe, where it talks about, these what they call phenotypic descriptions in the literature, right? The grandiose phenotype, but also an opposing kind of counterpart that the authors here kind of distill into vulnerable uh, narcissism. But where that came from and how that sort of functions within the context of the pathology is a gigantic question, and one that is sort of anathema to the powers that be, so to speak, who write the DSM. They don't seem to really consider that and how that interplays. But yeah, great question, and certainly one we can talk about.
I guess that's where a lot of my curiosity comes from is like what's the resistance to incorporating like the full spectrum, the grandiose and the vulnerable side of narcissism, because I feel like there's a big pushback to understanding vulnerable narcissism. Like I feel like folks are quick to latch onto the grandiose presentations, but a little hesitant to consider the vulnerables. So I'm wondering about that.
Yeah, well, maybe we can start by just kind of taking a look at this lit review here. Um, I'm just scrolling down to it. So there's a table though, and it's labeled phenotypic labels for pathological narcissism, reflecting grandiosity and vulnerability. And it starts with Kohut in 1971. So for those who aren't aware, Heinz Kohut is the founder of self-psychology. That's a branch on the psychoanalytic tree, right? And specifically sort of invented in order to better understand narcissism and narcissistic pathologies, what Kohut called disorders of the self. So disorders that sort of impact the quality of self-experience, right? And if we're talking about a disorder like pathological narcissism or NPD, that mainly affects self-esteem and self-image, well, that certainly qualifies, right, as a disorder of the self. Um, and there are two columns here. One is grandiose themes, the other one is vulnerable themes. And then they just go through the literature all the way through to 2009, talking about how each of these sort of major, theorists or researchers identified the same kind of interplay between grandiosity and something like vulnerability. So, for instance, there's egotistical versus dissociative. That's one of that's from Bruchek, 1982. There's thin-skinned versus thick-skinned. Right, so thick-skinned would be grandiose, thin-skinned would be vulnerable. That's Rosenfeld, 1987. There's oblivious versus hypervigilant. That's Gabbard, 1989. There's willful versus hypersensitive. That's Wink, 1992. Exhibitionistic versus closet. That's Masterson, 93. Empowered versus disempowered. That's Cooper and Maxwell, 95. And on and on. Arrogant versus shy. That's Roningstam, 2005. Grandiose, Malignant versus Fragile, that's Russ et al., 2008. And then finally down to Pincus et al. In 2009. Pincus is one of the authors of this study. And that's Grandiosity versus Vulnerability. So it's very clear that at least in the last 40 years prior to this article, there was a consistent theme in how clinicians and researchers were writing about pathological narcissism, noting both the grandiose experience as well as its counterpoint, right? The deflated or collapsed experience. Um, as far as like sort of how that came online, Dante, to your question, I think, well, I'll put this question out to you. it's hard for me to imagine something like grandiosity making any sense at all
Hmm.
without it, the counterpoint in the dialectic
Hmm.
of vulnerability.
Yeah, you make a good point because generally when we think of, say, NPD, it's just the grandiosity and not understanding the counterpoint, that it's an overcompensation of something, right? And so I think with the article, what it really highlighted was um, where someone may think that, well, what type of narcissist are they? Are they a vulnerable narcissist or are they a grandiose narcissist? Which one is it?
Right.
And the article is telling you that no, it's the same thing. It's just how it's being expressed in the individual.
Beautiful, beautifully put. Yes. That this is an interplay of two sort of poles within the personality, right? One is compensatory or defensive. That's the grandiose one, right? I'm not weak and ashamed. I'm strong and proud, better than you, right? And then there's what necessitates that kind of inflexible and distorted experience of self. Why does the person have to believe that about themselves? And the obvious answer, and the one that's been identified over and over and over again for the last 120 years or whatever, is is that well that their self-experience is actually fragile. That without that kind of constant idealizing experience, using people as self-objects, so to speak, to use Kohut's term, um, then their self-experience collapses into shame, into devalued images of the self. Right? I like the way the psychodynamic diagnostic manual puts it when it discusses the narcissistic personality type. They say, well, the core conflict is uh, around self-esteem. The person seeks experiences of inflated self-esteem in order to defend against experiences of deflated self-esteem. And it's pretty obvious on its face. But I think part of the problem is that vulnerability is hard to see when the person's grandiose and defended because of how externalizing they tend to be, right? It's not me, it's you. You're the one who sucks, not me. You know, you're the one who's weak. I'm not weak, right? But also because when the person is in the vulnerable phase of the disorder, it looks like all kinds of other disorders, right? It looks like depression. It looks like social anxiety. It looks like generalized anxiety disorder. It looks like, a borderline personality disorder or dependent personality disorder, right? Um, in one video that I made early on, I was talking about how it is essentially impossible to accurately diagnose someone with NPD who's in a vulnerable phase of the disorder based on their presentation. There's nothing in the DSM outside of the alternative diagnostic criteria that would capture that experience.
Hmm.
Now,
So
that's
therefore,
changed.
it's hard to diagnose then, right? With
Yes.
DSM criteria.
Yeah. Yeah. And I think a lot of therapists don't recognize it when it's sitting in the chair, um, because patients in a grandiose state, well, they don't tend to come to therapy. Why would they? When they're in a collapsed or vulnerable state, they do come to therapy, but it doesn't look like NPD, so it gets misdiagnosed. I can tell you how many people I've assessed who told me, "Oh, well, I have dysthymia, right, or pervasive depressive disorder." And it's like, okay, yes, maybe, but that's just a part of the the NPD. But they thought that was the whole story because that's what they've been told. Just
That sounds
inexplicable chronic depression, you know.
that sounds really disappointing for the client coming in because like at a state where they're maybe so desperate for care, and really ready to open up and see, but then because the characterization narcissism is so one-sided, they're really not seen, and that's like a recapitulation of really like the self wound.
Yeah, that's a really good point. And I wonder, Deanna, if you could say just a little bit more about that, not to put you on the spot, but because of how important that what you just said was, that kind of recapitulating of a essential wounding, right?
Mm. Yeah, well, just it, the core of narcissism is like really not being seen for the authentic self, or you know, held as your own person, and then you're going in to get care finally at that stage where you're vulnerable and open to it, and then you're labeled as something else and really just misunderstood, and
Mhm.
continually like expressing, screaming for help in so many different ways, conscious, unconscious, verbal, nonverbal, and still not being seen or understood. That can feel like hopeless.
I would imagine so. Yeah. As well as what people who maybe identify as having some of these issues get back from sort of the larger cultural discourse, right? Which is
Mm-hmm.
its own kind of uh, misattunement, its own kind of mischaracterization, right? Oh, well, you're a predator, right?
Mm-hmm.
Um, and the person's like, no, I just don't have like a stable self-image. Um, so the conflation of NPD with abuse, right? That the two are somehow synonymous with each other.
Mhm.
And it's something that this article doesn't address explicitly, but they do kind of point in that direction by talking about this criterion issue, right? This essentially this issue of definition, right? Like, so when we investigate NPD, what instruments are we using? What are the target characteristics that define NPD, right? Is it what's listed in the DSM? Well, because that seems like it might not be a valid construct. And they go through some of that research in this article as well. So if it's not the criteria in the DSM, then what criteria should we use, and how should we best measure those criteria? Should it be a self-report assessment, like a questionnaire? Should it be an observational assessment, like a clinical interview? Should it be like a collateral assessment, like the reports of a loved one, let's say? Or something even more kind of outside the box, like a projective assessment, like the Rorschach. They mention that in here too, as like, they're kind of going through all the different assessments that people use. One of them is the one that we use, the Shedler-Weston assessment procedure, the SWAP. Um, but and that being a particular strength because it's a combination of different things. But yeah, it's a real problem if we can't define our terms as a field, then we're going to have disparate research, some that investigates NPD as just grandiosity, right? It's just trait based and it's
Mhm.
grandiosity. That's it. That's all it is, right? And there's plenty of research that does that. In fact, prior to the publication of this article, 76% of all research into NPD used an assessment called the NPI that only looks at grandiosity, essentially. And so, how skewed is all the research using that instrument, right? Um, versus other folks who are maybe going in a more holistic direction, right? And they're going to get different results because grandiosity on its face just by itself, well, it doesn't correlate meaningfully with other forms of psychopathology,
Mhm.
right? Somebody who's grandiose and they're like, "Yep, I'm the best. See you later." I mean, like, okay, well, they're not reporting distress,
Mhm.
Mm-hmm. Mm-hmm.
right? But that same person, after they get fired from their job or left by their significant other or whatever, and they're in a collapsed, vulnerable state, suddenly Now you start to see all the distress, right? Now you start to see the sort of borderline level issues that might always be there, but just kind of under the surface. And that gets us into the overt versus covert dichotomy. But um, there's a research article out there that appears to support the position of every person, every player on this field, right? The trait-based people, the predatory people, the folks like us who are like, well, let's talk about the whole picture here, the full human experience involved. There's research out there for everybody that seems to sort of support their position. And that's what these authors are saying. This is the criterion problem. When people talk about narcissism, oftentimes they don't know what they're talking about, and neither does anybody else. That's how bad the situation is. And so, if the experts don't know what to think, the the folks who are seeking clinical services, I mean, that really leaves them in the dark.
Yeah. How skewed do you think the diagnostic rates? I think the article says, is it less than 1%?
Less than 1%. Yeah.
But also at the same time, clinicians, um, I guess
Identify it
rates
in
are
the
higher,
practice, but they don't diagnose it.
which is
Mhm.
interesting, right?
Yeah.
How
Yeah.
so? How much do you think, like, if that was considered full scale, like, what do you think the difference of diagnostic rates would be, say, if from 1% to what?
Well, there's an article that came out a couple of years ago by Igor Weinberg, and it was another kind of review of the literature and that sort of thing, and it estimates up to 20% of outpatient therapy patients are being seen for some kind of pathological narcissism. So that's a pretty big swing. That's a pretty wide gap. NPD is diagnosed in around a little bit less than 1%, according to this article. And this is a lit review, so it's putting together lots of different articles. But some kind of pathological narcissism might make up to 20% of outpatient psychotherapy services. So again, I think it points to just how poor the NPD construct actually is. Clinicians don't like to use it because it doesn't describe anybody in their practice,
Hmm.
right? But if you were to give them instead something like the pathological narcissism inventory and say, okay, now look at these different indices. Here are the grandiose ones, here are the vulnerable ones, hiding the self, entitlement rage, right? Stuff like that. And say, now, how many of your patients seem to have some of these issues? Well, then I think the estimates go way up, right? Um, and this gets to the issue between pathological narcissism versus NPD. And I think it might be worth it to just read how they define pathological narcissism here, because I think it's a good definition. So they define narcissism, just plain narcissism, as the ability to regulate self-esteem and manage needs for affirmation, validation, and self-enhancement from the social environment. It's pretty straightforward, right? So this isn't pathological. It's not non-pathological. It's just they're essentially identifying narcissism as like a core psychological facet, right? We all need to manage and regulate our self-image and our self-esteem. That's narcissism. So if you put it that way, it's a pretty broad thing. And then they define pathological narcissism. Let's see if I can find it here. I highlighted it, but I highlighted a lot of stuff.
And as you look for that, I think it's important to discuss, like, you're discussing pathological narcissism, but there is normal narcissism, right? Just as part of our human personality. Normal narcissism would be like a healthy self-regard, having ambition, capacity to seek validation, while maintaining reality testing. So there are the normal range, which we all have at different times, and I think it's healthy. But then it goes to the pathological side.
Right. And they even ask in the article, okay, they even ask in the article the question of, okay, well, is healthy narcissism just the opposite of pathological narcissism? In other words, are they kind of at opposite ends of the same spectrum, or is pathological narcissism something in its own right that is can be meaningfully distinguished from healthy narcissism, not just as sort of its as like the absence of healthy narcissism, but rather the presence of something pathological. Um,
Yeah, good point.
so I can't find the actual definition. But in short, pathological narcissism, according to this article, is an impaired capacity to regulate self-esteem and maintain a coherent positive self-image. Um, so that too is a very broad category. And I think that's important because it's not the same thing as NPD. And that's why I'm always separating them out when I'm talking about them, pathological
Mhm.
narcissism or NPD. NPD involves pathological narcissism, but it is its own distinct diagnostic entity. Whether we're talking about the DSM model or the PDM model, or something more akin to what I use, which is, taking a look at the level of personality organization, excuse me, and the level of kind of dysfunction in the personality. Not just narcissistic dysfunction, but overall dysfunction. So in other words, the question that I ask, and you by extension working with me, is there a personality disorder? And if so, what kind is it? Right? Um, versus the categorical approach, which is how many personality disorders are there? Right? Oh, the person has BPD and NPD and antisocial personality disorder. No, the personality is disordered. Okay. Now let's talk about the different flavors of conflict and preoccupation that show up in the context of that personality disorder, right? So for NPD, the main conflict that shows up is pathological narcissism, right? Does that make sense, that distinction? And I'm asking not just does it make sense to you, but do you think it makes sense to the folks watching, all three of them? Like does that make sense, do you think?
Well, NPD is something that's diagnosable per certain criteria.
Yes, and that's if we're going by DSM NPD. This again, we're getting back to the criterion problem. So I've treated patients and assessed them where I was like, yes, your dominant presentation lines up pretty well with DSM NPD. But there's a reason why the assessment that we use, the SWAP, the Shedler Western Assessment Procedure, which they talk about in this article, has multiple personality profiles. One of them is the DSM profile, but the other one is what it calls the personality syndrome profile, which is derived from their own statistical and clinical investigations. It mirrors in a lot of way. It sort of parallels the DSM categories, but they're not entirely the same. So the personality syndromes profile draws is much more similar to the conceptualization of pathological narcissism used here in this article, where it's a combination of vulnerable and grandiose dynamics, so that you could see it whether or not the person was actively grandiose, right? Um, so yeah,
And Mark, do you like to differentiate between vulnerable narcissism and covert narcissism? So I see those two used kind of interchangeably. I don't know if there's
yeah,
a difference.
yeah. Well, I think that the article here also addresses that distinction, right? And it does so. It actually has like a hierarchical um, illustration, right? Where it sort of says, okay, this is how you can think of it. You've got pathological narcissism at the top. You've got two lines coming down. Okay. One is narcissistic grandiosity. The other is narcissistic vulnerability. And then below each of those, looks like a family tree. Below each of those, there are two additional squares, and that's overt expression, covert expression for each one. So v narcissistic, vulnerable narcissism can be expressed in overt ways or covert ways. And the same thing goes for narcissistic grandiosity. So overt versus covert, these are not distinct types. These are modes of expression, right? So when somebody's in a grandiose phase of the disorder, they are overtly grandiose. It's obvious to everybody, right? But they're covertly vulnerable. That's the
Mm,
hidden underbelly of the grandiosity that's not readily apparent until you start to dig a little bit. Then you start to realize, oh, they are self-aggrandizing in order to elicit admiring reactions from the people around them. Why do they need those admiring reactions? In order to help prop up a fragile
mm,
um, self-image
mm,
that is feels to them like it's about to collapse into all kinds of shit. Shame, humiliation, abject devaluation, suicidality, right? Despair. So that's the covert vulnerability. The same thing goes for a vulnerable presentation. The vulnerability is overt. That's what's obvious and on the surface. But the grandiosity is
it's
covert.
covert.
Yes. Yeah, exactly. Why do you feel so ashamed after your experience at the party last night? Well, it turns out they covertly expect that they should have been the life of the party,
Mm,
and they weren't. And now they feel ashamed.
mm.
Right? So the covert grandiose expectation drives the vulnerable symptomatology, and vice versa. The covert vulnerable um, experience drives the grandiose symptomatology.
So the overt and covert are really good conceptual models, not to differentiate grandiosity and vulnerability, but more so to understand the dialectic and how they exist simultaneously, how the grandiosity and vulnerability exist
Absolutely.
simultaneously.
Yeah. I mean, it's if we're thinking about personality pathology as a dynamic process, not static traits, right? But as a dynamic, continually sort of um, ch shifting and changing process inside the person, then yeah, the covert experience drives the overt experience. Yeah. Which a lot of people are confused about, right? A lot of people think that covert narcissist means like, I don't know, like the shifty dude with like the sunglasses on, surrounded by smoke, you know, the secret narcissist, right? That you got to watch out for before he like pulls you into his trap, you know. No, that's a mythologized, strangely, a mythologized version of narcissism, which itself is based on a myth, right? So,
Yeah.
it's like we got like multiple layers of mythologizing happening at that point. The clinical reality, and I'm sure you guys have seen this, too, is that there's always dimensionality here. It's never just like this person is inexplicably like grandiose. What even would that be? How would you even begin to think about that? You know, it's like, well, okay. So that what they're just the I mean, even like the best caricature of grandiose narcissism I can think of, which is Gaston from Beauty and the Beast, is obviously fragile. You know, I mean, if you just all you have to do is just sit and watch the movie and you're like, oh, I see. Okay. This guy is like incredibly insecure and incredibly inflexible about how he needs to be and needs to be perceived and needs to look, right? And feels unbelievably threatened by the presence of the beast, right? Who Belle seems to actually love. Incredibly envious of that. And that's some of Gaston's vulnerability, right? I mean, all of us are we're all humans, and we all consist of a full dimensionality. Uh, so when diagnostic um, categories try to collapse that complexity into a two-dimensional caricature, I think that's when we really start to go wrong. And I think that's the situation that the discourse has been in for a while concerning NPD.
Do you think culturally, uh, I guess NPD might be viewed differently or maybe less demonized if there was more awareness of the vulnerable narcissistic pole that is in every person who might be diagnosed with that?
Well, what do you think?
Yeah, I think this is an important thing because I think just the layman and most people only understand the grandiose aspect. And I think that when you have that type of behavior, then it comes with a reaction. Um, but understanding underneath that is that overcompensation and the feelings underneath that are more vulnerable. I think that it seems that people would have a little bit more empathy for that type of behavior and understand its organization and why it shows up the way it does. And that knowing that there can be healing and therapeutic work that can work towards overcoming that versus just the demonizing the disorder and demonizing anyone who shows those type of characteristics.
Yeah, I think you're right. I think if we have a more humanized portrait, um, one that includes both the covert and the overt aspects of this, both the grandiose and the vulnerable, and conceptualizes it dimensionally. You know, in other words, it's not you either are or are not a narcissist, but we all have some, you know, aspects of healthy narcissism going on, but we all have aspects of pathological narcissism going on too, you know? Um, the more that is kind of understood, then the easier it is to think of folks who struggle with this as people, right? Not some other, but just these are in some cases extreme and inflexible variations on normal human experience.
Mhm.
Um, one thing I think that's important to realize here too is that pathological narcissism, yes, it shows up in NPD, but it shows up all over the place in all kinds of disorders and contexts of human experience. Right? So think about major depressive disorder, right? What are some of the diagnostic criteria there as they pertain to self-esteem and self-image, right? Feelings of
Yeah.
shame or worthlessness.
Mm.
Yeah.
Social withdrawal,
Yeah. Isolating.
suicidality.
Yeah. And to be sure, not all social withdrawal or suicidality is related to pathological narcissism, but sometimes it is, right? Um, so, you know, am I saying that everybody who's depressed is a narcissist? No, that's not what I'm saying, right? That would be a categorical approach. That's not what I'm saying. What I'm saying is depression often involves a component of pathological narcissism because it involves a collapse of self-esteem and the presence of uh, highly devalued self-images. I'm terrible. I'm worthless. I'm no good, right? That is a failure. That is a dysfunction of self-esteem maintenance, right? That the authors here talk about, when they define narcissism, right? The ability to regulate self-esteem.
Which is so interesting because the normal person wouldn't believe that a person with grandiose narcissism lacks self-esteem.
Absolutely. Yes. And to be fair, overtly they don't. But the problem is that self-esteem that they have, it's not realistic. It's not stable,
Hmm.
right? And you need both of those to be true to have sort of a healthy ability to regulate self-esteem. It needs to be stable, can't rise and fall depending on what's going on in the moment, right? You can't feel absolutely worthless because somebody didn't look at you the right way, but then feel like you're literally the best person who's ever lived because, you told a joke and people laughed at a party. That's not stable self-esteem, right? And it's not accurate. Grandiosity is by definition a distortion in self-esteem and self-image.
I'm really curious about the interplay between pathological narcissism and chronic trauma because I went to a presentation once and they differentiated like episodic trauma, like PTSD from complex trauma, and the difference is that complex trauma has distortions of self image, and I thought that was so interesting, and I've just always been curious about that with this perspective of pathological narcissism and how it exists in so many different places.
Yeah. Well, I mean, what do you think? Like, do you think we could conceptualize complex trauma, excuse me, as the sort of I'm gonna shift what I was just about to say. We could so complex trauma can have all kinds of different facets and symptomatologies associated with it, right? Anxiety, depressive, right? Emotional dysregulation, paranoia, hypersensitivity. All these different things that could show up, and we could say, well, yeah, I mean, it makes sense if somebody is sort of chronically experiencing unsafe environments, if there's a long history of complex relational trauma that the person has suffered, right? There will be distortions in their perception of themselves and other people. The distortions in the perception of self, those are related to pathological narcissism, right?
Mhm.
So this is a difficult paradigm shift, I think, for folks because it's broadening the category in a significant way. Not in it's not this isn't like crazy town, what we're saying. It's not quackery. This is going back to the sort of roots of what narcissism is conceptualized to be, which is how we regulate our self-esteem and our self-image. And so deficits or pathologies in that process, well, that's pathological narcissism. I'm not saying people who are depressed are like abusers or whatever. I'm not saying people with complex PTSD are narcissists. I'm saying complex PTSD involves distortions in self-image and deficits in self-regulation and self-esteem. That is pathological narcissism. So it's just one piece of it, right?
Mm.
But I really think, honestly, I think we could conceptualize, and I don't think we'd be inaccurate to do this. We could conceptualize personality disorder itself in terms
Mm.
of a kind of complex trauma.
Mhm.
Um, and that's actually how I tend to think of it, right?
Right, because it comes from somewhere.
Yeah,
It's unhealthy, right? It's
yeah,
not normal, healthy functioning, upbringing, wiring,
yeah,
attachment.
yeah. They're all kind. I mean, if you look at any personality disorder, you're going to see a lot of the same issues that you see in complex trauma. And again, now, I want to be clear, I'm not saying that everybody with complex trauma has a personality disorder, but I might be saying everybody with a personality disorder has complex
Has
trauma.
complex trauma.
Yeah. Yeah.
Yeah.
Can make that
I'm not
argument for
saying
sure.
that everybody with complex trauma has pathological narcissism, you know, but I'm saying sometimes it shows up there.
Mm.
All right. Well, maybe that's a good place to stop. Um, so I guess, the last thing I want to say is, I appreciate both of you being here and engaging in this work. For the folks who may be watching this who might not know, Dr. Young and Dante are registered psychological associates in my practice. And so that means that they are actively taking on patients, treating patients, assessing folks. They are able right now to work with folks who are in the state of California and offer those services for a reduced fee. They work under my supervision, and you've seen a little piece of some of the training that we do. We do this training on a weekly basis, but I'm going to hopefully be uploading our didactic seminars on a bi-weekly basis because on the off weeks we're kind of digging into the psychoanalytic literature, like the foundations of some of these concepts that go way back. And I don't know. I don't know how useful that's going to be for folks to see. But on the on weeks, we'll be talking about articles that are more contemporary, like this one, that help to kind of frame the problem and discuss treatment options and approaches. So thank you so much for being here, everybody. Thank you so much for being here, Deanna and Dante. Thanks for being a part of this work. And if anybody wants to learn more about the services we offer, you can contact us through the website at healnpd.org. All right. So we'll see you again in a couple of weeks. Take care.